Nothing is more frustrating than getting into a workout routine only to have it ruined or delayed by an injury. Orthopedic surgeon Dr. Junius is here to share some insight on how to protect your body from injury during exercise. Thanks for joining us today.
Good morning, thanks.
You know, what are some of the common injuries that people get when they're trying to work out and it doesn't go so well?
Well, of course, sprains and strains are very common for people who initially begin an exercise program. Another thing is making a previous injury worse or a previous condition like arthritis.
All right, so if we're exercising, if we're a novice or if we're a super sports person, what's the most important thing starting out an exercise routine?
Well, the most important thing is warming up for the day, getting your muscles limber and getting them warmed up before you begin the more strenuous part of the exercise regimen.
And if you're not, you know, an exercise person at heart, what are some of the best quick warm-up things that you can do just to make sure you're ready?
So like a light aerobic routine, getting on a bike, that would be very good, and also stretching program as well.
All right, if you're an elderly person and you decide you want to get into some exercising and you haven't really done it a lot, you know, I guess the elderly face problems with sometimes brittle bones and things like that. What should they do?
Of course, exercise is good for people of all ages, and especially the elderly. If you've never been involved in an exercise routine before, it's always a good idea to get the help of somebody who does have experience, like a trainer or a physical therapist.
All right, but you said actually that may help issues with the bones and osteoporosis, just getting a little less exercise. How does that work?
Absolutely. So exercise, especially weight-bearing exercises, can actually stimulate the production of bone and the building of bone. So it actually is good for patients with osteoporosis.
And you know, I find that even if you take a brisk walk or a little jog like we see these people doing, it helps your mood, doesn't it? Is it just in our minds, or is it really helping our mood?
Well, that's the way I use it for sure, but absolutely, you know, more than the physical effects of activity, the mental effects are well documented.
If you feel like an injury, a lot of people say, man up, push through it. Is that the right thing to do?
So that old saying, no pain, no gain, it depends on what the pain is. And of course, a chronic problem like arthritis or bursitis or a tendonitis, sometimes pushing through that injury, it won't go away, and you really need to pay attention to your body and listen to what it's telling you.
Yeah. The best form of exercise for someone who's not a super exercise person, would it be walking?
Walking is a great exercise, and I tell patients to do that a lot because also it's a social activity as well. But a good aerobic activity is good, and walking is one of those, but also weight training is important as well.
All right. And you can swim? That's not so bad on your joints?
Swimming is a great program.
All right. Dr. Junius, thanks. You make us want to get out there and get moving. Thanks a lot.